Welcome to the Microsoft Cloud Digital Series in Healthcare. My name is Kevin Chia. I'm the Canadian Marketing Healthcare Lead. And man, do we have a really good program in store for everyone today. We have speakers from Alberta Health Services, Nuance, and Microsoft really getting together to talk about a tough problem on just how Canadian hospitals are tackling clinician burnout with speech AI documentation. But before we begin today's programming, I got a couple of housekeeping items for everybody. First, on the left side of the screen, you're going to see our live Q&A chat. Any of our panelists will be available to answer any questions you have on the content using the text Q&A. So if you have any questions, I highly encourage you to ask them as they'll be available for chat. If you're tuning in on demand, well, you can always reach out to us using some of the resources below. Second, everybody is going to receive a copy of today's webinar within 24 hours. If you didn't get it, check your junk mail. Third, on the right side of the screen, you're going to see our survey. Love the content, hate the content, wish we would cover another topic in Canadian healthcare technology? Let us know. We really value some of that feedback. Last but not least, I'm really proud to say this, but today's webinar has been closed captioned for accessibility. All you have to do is turn on the accessibility captions below. That's all I had for housekeeping items. I'm going to go ahead and introduce our host for today, Helia Mohammadi. She is the Chief Data Scientist and Healthcare Lead for Quebec and Western Canada at Microsoft Canada. Sit back, relax, and we hope you enjoy the show.
Hello and welcome everyone to an episode of Microsoft Cloud Digital Series. I'm your host, Helia Mohammadi, Chief Data Scientist and Healthcare Industry Lead for Microsoft Canada. In this episode, we will share some great content on how Canadian hospitals are reducing clinician burnout with speech AI documentation, and we have with us amazing speakers from both Nuance and Alberta Health Services. But before that, I would like to thank our healthcare professionals and frontline workers for their selfless service during these difficult times. At Microsoft, we have been privileged to have played a small role leveraging our technology platform to partner with public servants across the country to respond to this COVID-19 emergency. With that said, as we all know, healthcare organizations are going through unprecedented times, and as they are ramping up to combat the second wave of COVID-19, hospitals are preparing to manage an influx of patients. This is while these organizations are complying with Canadian federal and provincial patient regulations as well. Now, more than ever, physicians need to reduce their administrative tasks and to be able to quickly document the patient's complete story. So it's evident that such AI-infused solutions are essential to empower the healthcare organizations to better respond to this pandemic. We recently announced the first of its kind Cloud for Healthcare that helps healthcare organizations connect data from across multiple systems through the common data model. And this end-to-end solution focuses on three main areas, including enhancing patient engagements to improve health outcomes, empowering the health team collaboration to provide best possible care, and finally improving clinical and operational outcomes to predict risk and help improve quality of care. And all of these can be done in this central, connected, seamless, and end-to-end solution environment. When, for instance, patients want to access their health data, for example, as part of a federal or provincial mandate, Microsoft Cloud for Healthcare provides secure portals and mobile tools to enable the data flow securely through every point of care. In this way, healthcare organizations can continuously improve the patient experience and health outcomes. Additionally, with virtual health as part of this environment, secure AI-powered health bots and virtual visits can get integrated into the care journey to expand services to more patients. On the health team collaboration side, Microsoft Cloud for Healthcare offers continuous patient monitoring and care coordination and care team collaboration. And on the clinical analytics and operational optimization side, data silos can now be easily integrated, and protected health data can be leveraged using FHIR, AI, machine learning, and other applications to generate data-driven decisions and ultimately help improve patient care. Nuance is one of our partners who is building solutions leveraging Microsoft Cloud to reimagine care delivery and improving healthcare operations. We are here today to share how physicians at Alberta Health Services, the largest single health authority in Canada, have adopted an intelligent, voice-driven clinical documentation solution to speak their notes directly into the EHR on the cloud from any application, device, or care setting in real time. This solution unburdens physicians from clicks and typings on the keyboard, and the solution results in achieving greater flexibility in the physician documentation workflow and led to improved reporting quality and compliance, reduced costs, and most importantly, gave time back in their day for patient care. Now, let's go ahead and welcome our panelists. We have Duncan Salt, the General Manager and Vice President of Client Outcomes and Healthcare at Nuance Communications. And from Alberta Health Services, we have Dr. Stuart Rosser, the Chief Medical Information Officer. And we have Kathleen Addison, Senior Provincial Director for Health Information Management. And we have Karen Carlson, the Director for Health Information Management.
Yep, thank you. Duncan Salt, General Manager for Nuance's Healthcare Canadian business. I'm honored to be here with Alberta Health Services and Microsoft in this chat.
Wonderful. Dr. Rosser?
Thanks, Halia, for inviting us to this conversation today. My name is Stuart Rosser. I'm the interim CMIO for Alberta Health Services, and I've been involved in the design, build, and implementation of our provincial clinical information system for the past 3 years.
Wonderful. Kathleen?
I'm Kathleen Addison. I'm the Senior Provincial Director for Health Information Management, and I am responsible for HIM for the province at Alberta Health Services. Thanks.
Hi, everybody. Thanks for inviting us to join the conversation today. My name is Karen Carlson, and I work as the Director for Health Information Management Provincial Services and also South Zone. And under Provincial Services is where the Dictation Speech Recognition Transcription Program falls.
I'd like to direct the first question to Duncan. Nuance and Microsoft are in a strategic partnership to accelerate the delivery of ambient clinical intelligent technologies. Please speak to what ambient is and how this opportunity uses advances in cloud and AI technology to transform healthcare.
Yeah, absolutely. And thank you for the question. You know, we are very proud of our partnership with Microsoft. It goes much further than just the hosting of our cloud environments and applications from a secure and safe perspective. But our partnership is a deep collaboration and development partnership for ambient solutions. And one in particular is called Dragon Ambient Experience. It really is a technology that is able to listen to the conversation between a patient and the physician and capture that, diarize it, so that the conversation is captured both from each individual and then extract from that the pertinent information that's relevant to the medical record and create a draft of that medical record that we could present back to the physician in a very accurate, timely fashion. So in essence, ambient is really taking that visit conversation and leveraging technology to automatically create a medical report.
This is fantastic. So maybe, Duncan, you can address this next question. Are physicians in Canada suffering from burnout? And if so, what are they overburdened with?
Yeah, absolutely. I mean, burnout is real. It is extensive. It's well documented, and at the same time, it can be a catch basin for a lot of different issues and problems that physicians are facing. Right? COVID clearly is contributing to burnout today. But from our perspective and what we'd really like to address and how we can help out, it's really about documentation. Right? There's a plethora of regulatory requirements around documenting what happened between the patient and a physician. And that contributes to a fairly substantial amount of a physician's day, ranging from 30 to 40% of their day spent documenting what actually transpired that day when they were seeing patients. Ultimately, this is contributing to burnout, right? What we all, I think, want our physicians to do is to be able to focus on the patient themselves and on the care of that patient. So what we have done is tried to introduce technologies that can address, right, that burnout and reduce the amount of time that physicians have to spend with documenting, face the patient, right, spend time focused on the patient and less time on documentation.
These are great points. Thank you for that. And what's the value proposition for a cloud-based speech recognition solution such as DMO? And how has DMO helped to alleviate burnout? Can you speak to the pain points?
Yeah, absolutely. From Dragon Medical One's perspective, moving that into the cloud created some great benefits, right? That an on-premise system had from a challenges perspective. So immediately it's available pretty much anytime on any device, whether you're at a PC or you're mobile on a phone, iOS device, or a tablet, right? So it gives that flexibility from a workflow perspective. And ultimately, what we're trying to do with speech recognition, again, is to reduce the amount of time that any physician has to spend either documenting or navigating the EMR. So leveraging voice, which arguably is the fastest way that we can communicate in order to download that patient experience and note and do that in the most efficient and productive fashion. Again, reducing time and trying to alleviate the amount of time that physicians need to spend documenting.
Duncan, how significant of a shift has moving documentation in the EHR to the cloud been for Canadian healthcare systems? And also, are physicians able to use their voice to navigate with all EMRs?
Yeah, so ultimately moving into the cloud was significant, right? It allowed us to easily innovate, right? Innovate faster, for our clients to consume that innovation faster, right? Because it becomes immediately available to them. And yes, the types of integrations that are available today allow us to better plug and play into the EMRs. And again, leveraging voice, both from a documentation perspective, but also a navigation. And then the next generation is now moving into virtual agents, virtual assistants, so that you can, call up information, go to a specific place in the EMR, place orders with your voice, but really leveraging voice as your conduit to both navigating as well as documenting.
Now, I'd like to direct this question to Dr. Rosser. As the CMIO of Alberta Health Services, what problems were you trying to solve for by developing DMO?
So I think it was less about trying to solve an existing problem than it was about preempting any future problems we might encounter with the implementation of our CIS. So by the time we got to the phase of design, build, and implementation, there was already a lot of data out there about how physicians were spending or misspending their time. That included a lot of data about the amount of time they spent attached to keyboards rather than speaking to patients. We were already hearing from some of our constituents that they did not want to have an EMR implemented in their hospital system that was just going to distract them from patient care. So providing them with Dragon Medical One and its complete integration into our clinical information system was a bit of a carrot to say, hey, you can take care of 2 steps in the management of your patients in one fell swoop, and it won't take you away from the meaningful interaction with those patients. So that's really what we were trying to preempt. The long-term goal, of course, was to be able to reallocate some resources from our transcription services, but that was really a secondary consideration from a prescriber standpoint. And I will point out that we didn't limit access to DMO to our physicians. We actually granted it to all of our prescribers within the province, which included our nurse practitioners and our prescribing pharmacists as well.
Wonderful. And this question is for Karen. Kathleen, feel free to add to this. Where are you in the deployment of DMO, and what was the plan for deployment, and how many physicians and which medical specialties are involved, and are there any trainings?
Yeah, it's a great question, Helia. Thank you. So we are in wave 2 of a 9-wave implementation of our clinical information system. And it's a multi-year initiative. So we started in November of 2019 and anticipate wrapping it up in 2023. So currently we have 8 sites that have come on to what we call Connect Care, which is our clinical information system. And so we've got providers or prescribers from those 8 sites that are currently using the system and using DMO. So we've got probably on any given day about 450 prescribers who are using the system. And as Dr. Rosser indicated, that could be nurse practitioners, it could be physicians, it could be medical learners. Midwives have just come on with our Wave 2 implementation as well. So we did not limit it to any specific specialties. We basically provided the offering to whichever prescribers wanted to use the DMO tool.
Wonderful.
Karen, it's Kathleen. I'll just jump in. I think our ultimate goal eventually will be to even open up Dragon broader than just to our prescribers, but we're not there yet. And so what we're trying to do initially is just really replace we had from a transcription perspective, and that's primarily around prescribers and some high volume other users, but that plan has not been activated yet. Thank you.
Thanks, Kathleen.
Excellent. What was the experience at AHS like in migrating EHR to the cloud? What are the primary benefits of speaking documentation directly into the EHR on the cloud? Maybe Karen, you can take a stab at it.
I think what we have experienced is really improved accessibility. So previously, a provider had to be in front of their computer to be able to dictate, and then there would be a delay in the transcription and then the introduction of that documentation into the EHR. And really, so now we've got the ability for a provider to use a mobile device. They can dictate from anywhere that they are able to access their mobile device and access the clinical information system. And I think it's really relieved the burden on the devices that we had previously that had to have the tools downloaded directly onto that device. So I think accessibility would be my answer to that question. Dr. Ross or Kathleen, anything from you on that?
I'll just jump in, Karen. I think the other benefit is the resources that aren't required to actually image each computer that the physician is using. So like you indicated, it's much more portable, but from a maintenance perspective, it becomes much less as well, and ultimately less cost from a hardware.
So from a CIS standpoint, it was less about migration to the cloud than it was implementation. For many of our end users, this was their first experience with a Nuance product with Dragon Medical One. And many of the rest of us had used individual licenses on specific devices and had that experience. This is a much more freeing use of the product. We have many different devices in our hospitals, some of them workstations, some of them thin clients, and none of them have any significant audio capabilities attached to them. They certainly don't have microphones or other sound input devices. And to configure them that way would have been difficult. Having the cloud solution allows each end user to take their preferred device and using PowerMic to directly dictate into the CIS to see what they're dictating as it occurs, to make the edits that they need, and then to send a final product to whoever needs it in real time. And so for people of us who are used to the old way, that was a game changer. For other people, it's just the way things are done.
Excellent points. Dr. Rosser, what other outcomes are you seeing as a direct result of DMO? Please speak to outcomes such as physician adoption or physician satisfaction, time savings, improved quality, and compliance.
So everybody that has taken the time to use Dragon Medical Run in our CIS loves it. And the main benefit is what I outlined previously. You can actually see what you're dictating in real time, make any edits that you need to, make any formatting changes that you need to. With our particular CIS, you can integrate it with smart phrases that will pull in various components from the chart into your note. Our uptake has been less with actually navigating within the chart using the DMO tools, but that is also a possibility, and some people have taken advantage of it. We've seen sustained uptake and continuing uptake in the stats that we have about declining use of our transcription services at every site that has been implemented. And at some of these sites, within 2 days of implementing our CIS and DMO, there's been a 90% drop off in transcription. And I know that Kathleen and Karen can speak more to that. We've actually had to moderate some end users' expectations about using Dragon Medical One. We're in a staged rollout of our CIS. And particularly for our learners, the ones that have had experience at one institution with using this product, really don't want to go back to using paper records at those institutions that have not yet implemented. But being the legal record of care at those institutions, we've had to moderate and say, I know you love this, I know it's great for you, I know it works for you, but until this site is live on the CIS, you have to use the legal record of care. So that is a testament to how much people have integrated this into their workflows.
Wonderful. And how do you anticipate the use of tools like DMO will impact Canada's government funding model and AHS individual hospital funding?
You know, I'm going to defer to Kathleen and Karen to help me answer that question. I don't see it having a huge impact in those funding models. Obviously, as DMO and cloud-based dictation, voice recognition takes off across the province, our overall costs for transcription services should go down. But that's the main economic benefit that I see. The rest is in softer terms of prescribers, the use of prescribers' time, and if we expand this out to non-prescribers within our system as well, the use of their time on keyboards, doing clinical documentation and navigating charts. I think our savings will be in time, and if time is money, then that's where we'll save costs. But I don't see it dramatically changing our funding models.
Okay.
Yeah, Stuart, it's Kathleen. I would absolutely agree that I don't see that this would change the funding models. It certainly is from an efficiency perspective and from a timeliness perspective, those are the benefits to be able to have the information available for the next care provider.
Perfect. And my last question is really for both Duncan and Dr. Rosser. What work do we have to do to update the solution, and what's next beyond DMO? What's next in the journey for tackling physician burden? Maybe let's start with Duncan from Nuance perspective.
Yeah, sure. The great thing about Dragon Medical One is it's become a foundational solution for Nuance. We are innovating on and around it. As you think about, how we can further improve either burnout or the quality of care, what we're trying to introduce is just as I discussed earlier around ambient technologies, the ability to document with less interactions in the PC, to actually use your voice to call up information and display it on a monitor that perhaps is sitting on a wall. In addition, the ability to introduce into Dragon, because it's available to the users throughout their workflow. It doesn't matter where they are in Epic. If we introduce technology at the right time, we could provide some feedback to them around the documentation, the quality, and or the severity of illness of that particular patient as well.
Wonderful. Dr. Rosser, what about Alberta Health Services? What is next in the journey for tackling physician burden?
Well, with specific respect to clinical documentation and the voice recognition transcription software, really the product as it stands right now is an incredibly useful tool, and we're looking for incremental improvements on it. For example, in our particular implementation of the CIS software, we have to run DMO as a separate application within its own window. It doesn't automatically launch from within our own CIS when we launch the CIS, and that would be a nice to have. Also, we have several fairly powerful mobile applications available to us, and we'd really like to be able to use some of our Dragon personalizations in those mobile applications. And then I think the third one that I heard from my colleague Chris White, who's really heavily involved in this work, is that it would be great if we could share or even push some of the personalizations that are AHS specific over to our colleagues who are also using this product. And like I say, the product itself is already, it's mature, it works well. That we can ask for these little value adds is a testament to the underlying software.
Wonderful. So any closing comments from other panelists?
We're at our infancy in our DMO journey. We've really introduced it to prescribers, but again, it's more from a clinical documentation perspective. We've got the huge opportunity from a navigation perspective, commands, although some of the personalization has done that, I think again, we haven't really done a lot of work in that area, and then expanding out to certainly more users. But certainly, like I said, we're at our infancy as part of our implementation and look forward to all of the added benefits as we go forward.
Wonderful.
And then from Nuance's perspective, right? The feedback today is very exciting from our perspective, right? We're very thankful and proud that it's working well. Love to, Dr. Rosser, see if we can address some of those concerns that you just brought up as well. But yeah, you're going through a dramatic change management, and that's a testament not just to the technology that supports this journey, but the leadership behind it as well. So it's fantastic that it's going well.
Excellent. And thank you, Duncan, Dr. Rosser, Kathleen, and Karen for sharing your early insights and experience at Alberta Health Services. With that said, I would like to thank all of our viewers for tuning in today. For those of you who would like to learn more, please visit aka.ms/healthcare in Canada. There you can find more healthcare technology webinars and Canadian healthcare provider case studies and some of the great partner innovations that are available in Canada to better support our healthcare systems. For those that are interested in learning more about AI and professional development, we've created a free AI business school for healthcare professionals in partnership with INSEAD at aka.ms/AIBS. It has 12 modules on demand and covers a large range of real AI healthcare case studies. As a quick reminder, myself and the rest of the panel are available in the Q&A text chat for any further questions. Thanks again for attending, and we hope to see you again on the next episode of the Healthcare Cloud Digital series.